are they going to pay for this extra cost of the drug? The difference between betamethasone and methylprednisolone is very little, $1.40 or $1.60 I checked. So for that itself, they were pretty upset. So I'm not sure how much the doctors will be willing to use it.
Personally, I don't use that much of sodium chloride in my injections, except 3 or 4 cc for interlaminar. So, and that is normal steroid. I don't use 1.5% or 3% high concentration. I used to use, and patient will, complain more pain, and I did not see any benefit. There might be some evidence of that it might be neurotoxic if it's in a higher doses. But otherwise, I think lower concentration of local anesthetic is safer than using higher concentration of normal saline. That's what I think. So for